Wednesday, July 12, 2006.
From NBC News, this is a special edition of Today with Matt Lauer, live from St. Petersburg, Russia, and Ann Curry, live from Rockefeller Plaza.
We're back at 7:43. We're bombarded with advice every day on how to protect our health. But when it comes to finding a top-notch surgeon or specialist, there is not a lot of information out there, and many of us just don't know where to turn. Here's NBC's Martin Savage.
When Will McDonough injured his knee, his family doctor recommended a surgeon.
I had asked if, do you know the person? Like, oh, yeah, he's good. But that was basically the extent of the conversation.
McDonough knew virtually nothing about that recommended surgeon, Dr. Thomas Youm. Youm says he feels for patients searching for information on a doctor.
They have to go through lots of loopholes just to be able to be seen by a specialist, so it's very frustrating for the patient and for the doctor.
The truth is, many of us know little about finding or choosing a doctor.
I go onto my health insurance company's website.
I ask around, ask friends.
Well, my experience has been referrals.
It's actually kind of hard.
We're talking about someone who could greatly affect your life.
Picking a good surgeon, finding a good hospital, has a profound impact on how well you do, and it can have an impact on whether you live or die.
There are some things you might want to know, such as how often has the surgeon really performed this kind of surgery? How capable is the hospital they used? Has the surgeon ever been sued? And if so, how often? But that information's hard to find. Only a few states, including New York and Pennsylvania, issue public report cards on surgeons, and then only heart surgeons. A national grading system for doctors is right now just talk.
People have demanded this information, and therefore, I think physicians and hospitals haven't really been willing to provide it.
Experts say it's really up to patients to do what homework they can and to ask questions. Lots of them.
I would say I'm doing really well. I just got lucky.
Because in America today, our healthcare may be cutting edge, but finding a doctor is still about as low-tech as it gets. For Today, Martin Savage, NBC News, Atlanta.
John Conley is the publisher of America's Top Doctors. Mr. Conley, good morning.
Good morning, Ann.
If it's up to the patient to do the research, this is a serious issue. Do you believe most Americans are not fully informed when they choose a doctor?
Absolutely. You know, people will spend a lot of time researching a restaurant to go to dinner or reviewing a movie to go to, and they'll just pick the name of a physician out of a health plan directory or phone book without any further research.
In
and
fact,
that's a mistake.
Oftentimes they choose because of location.
Office location is one of the primary considerations people use, and that's a mistake.
Bad choice because?
Yes.
You're going to choose a doctor who may not.
There are a lot of other important things you need to do.
Okay, so let's talk about them. I'm going to give a list. We're going to give people a list of what you advise. Be informed and an assertive patient. Make sure that your doctor is board certified. Assess doctor's experience. Check the doctor's disciplinary record. Interview the doctor. Whoa, I've never heard of that one. And seek top hospitals. Okay, let's take these things one by one. When you say be informed and assertive, what are you talking about?
Just don't take what's given to you. Really try to find the best. We all want the best health care. Do a little effort, a little research. Find out about the doctor's background and training. Board certification.
That's easy. You've got the internet today.
It is, but people don't use it. And most people don't realize, Amy, that a physician, once licensed, can practice in any specialty they want. You can have no training at all as a gynecologist, a pediatrician, psychiatrist, and you can hang up a shingle in any state in this country and practice in that specialty. Only board certification assures you the physician has the right training.
And on the screen right now, there is a www address for checking out a doctor's board certification. You want to assess your doctor's experience. Now, how do you do that?
Well, it's important. You can ask the doctor to begin with. There are some websites where you can get information, particularly for surgical procedures, on the doctor's experience and the hospital's experience. You don't want to go to a physician, for example, for open heart surgery who only does a few a year. You want someone that's doing a few a week.
We also have a website that we're going to put up on the screen here for checking a doctor's disciplinary record. And is it going to include everything?
It's, well, not everything, but if the doctor has been sanctioned, for example, if they have substance abuse problems, or they've messed up a couple of cases badly, either injured or killed people. And on our website, castleconley.com, we have links to all 50 states that have that information available online.
You know, this idea of interviewing the doctor, now that's surprising, because, I mean, we don't, a lot of us, I think, culturally don't imagine that we have that right or that possibility that the doctor doesn't give us time to interview him or her?
We
How
do,
do we start that
and
conversation?
you know, you want a physician that you can trust and respect, and that listens to you and will respect you. And it's your right, it's your responsibility, in fact, to interview that doctor and make certain it's somebody you're comfortable with. If you're not, and you feel reluctant about sharing things with them, it's going to have a negative effect on your health care. So you really need to be assertive and do that. You know, consumers today want that kind of information. Last year, we had 8.5 million people coming on our website and viewing doctor searches. That's a huge number, and people need that kind of information, and they have to be more assertive about getting it.
You know, we also have a website here for how to choose the top hospitals. We're going to put that here up on the screen. But you know, this decision, this effort, I mean, we cannot overstate all this material that's now available on the internet really makes it sort of really our responsibility to check this out, because you actually, just before this program started, before this interview started, talked about a woman who had a double mastectomy because she was with a doctor who she probably shouldn't have been hooked up with, because in fact she never even had breast cancer.
Yes, and that's not uncommon. You know, there are about 100,000 medical error deaths a year in this country, and many of them can be prevented. And it's our responsibility as consumers and as patients to really do that work and find out about the doctors we're going to and the hospitals.
John Conley, I think you've helped some people this morning. Thanks so much.
Thank you, Ann.
And by the way, I want to tell people that if you want to get any of those websites that we just mentioned, you can go to our website at today.msnbc.com. We'll have a list for you to make sure that you do your best job in finding a good doctor. And we'll be back with much more from today and from St. Petersburg in just a moment.